Everybody good? Okay, good morning, everyone, or actually good afternoon now. It's good to be here with my colleague Adrian Dix and Dr. Bonnie Henry here on the traditional territory of the Squamish, Musqueam, and Tsleil-Waututh First Nations. I want to begin by advising all British Columbians that we have been leading the way with respect to containment and processes in place to protect citizens and communities against COVID-19. We've been world leaders, in fact, in terms of the work that we've been doing here since we first responded to the threat back in January. We put in place emergency protocols at that time. Provincial Health Officer Dr. Henry and Deputy Minister Stephen Brown have been coordinating activities with regional health authorities, regional medical health officers, health services authorities like BC Emergency Health Service, BC Centre for Disease Control, 811, as well as Indigenous First Nations Health Authority. And that coordination has been able to deliver timely updates, as you are all aware, regularly advising British Columbians of the state of play in terms of cases, in terms of testing, in terms of actions being taken by the government. Right out of the gate, the BC Centre for Disease Control developed an independent test for COVID-19, making sure that we could more rapidly assess risk, rapidly assess outbreak, because we didn't have to send our samples to a national lab. And since January, we have tested 2,803 samples involving 2,008 individuals. By the end of next week, we will have 4 additional labs able to test for COVID-19, as well as, in the coming month, additional machines so we can continue to increase the testing available to British Columbians. You will know that until recently, British Columbia had tested more samples than the entire United States. Of course, the rest of the hemisphere is catching up with us, but I'm very, very proud of the work that Dr. Henry, Stephen Brown, and of course Minister Dix have been doing to ensure that British Columbians can have every confidence that everything we can do is being done. And we're going to continue to increase testing capacity as we see an increase potentially of the outbreak making its way to British Columbia. But our response has been robust, and I want all citizens to be comfortable and confident with that. Our number one priority, of course, is to keep people safe, to ensure that communities understand that there is a cross-government approach. And today, I'm appointing a Deputy Ministers Committee that will be co-chaired by Deputy Minister Laurie Hall from Emergency Management, British Columbia, as well as Stephen Brown from the Ministry of Health. This Deputy Ministers Committee will guide a whole government approach to this pandemic and ensure that we are as prepared as we could possibly be. And in addition, that committee will report to a committee of cabinet that will be co-chaired by Minister Dix and I, that will include Finance Minister Carol James, Labour Minister Harry Baines, Public Safety Minister Mike Farnworth, Tourism Minister Lisa Baer, and Economic Development Minister Michelle Mungal. And I want to, at this point, thank every healthcare practitioner, every nurse, every doctor, every care aide, every health sciences professional for the extraordinary work they've been doing to ensure that British Columbians can have confidence in our public institutions when it comes to addressing this issue. Healthcare professionals are at the foundation of everything that we do. And I know Dr. Henry, in her work with administrators and with healthcare providers, can give you more details on that. But it is truly heroic work. And we oftentimes overlook and neglect saying thank you to those people who put themselves at risk, put themselves in harm's way to ensure that we're protecting the public across the board. And I just want to acknowledge that today. But we're ready to respond as conditions change. BC's pandemic province coordination plan is already underway. This Deputy Ministers Committee will ensure that we are as topical and timely with information to you as we can possibly be. There is already actions in place to address the spread of this disease, and I want you to have every confidence that we're doing what we can to protect public services, whether it be education, whether it be transportation. Looking at challenges to our economy is critically important. These are a number of the issues that I've been dealing with other jurisdictions on. I've been in contact with Governor Inslee in Washington State as recently as Monday to pass my condolences and the condolences of all British Columbians to those who lost their lives to this disease in Washington State. And we discussed a range of issues, how we can work cooperatively jurisdiction to jurisdiction. In addition to that, I've been in regular contact with the Prime Minister and Deputy Prime Minister Freeland with respect to coordination with the federal government. The Council of Federation, which is the collection of premiers across the country, has had 3 conference calls in the past 10 days to coordinate efforts in that area. And also, of course, we'll be meeting in Ottawa for a First Ministers Conference next Thursday, Friday, and we'll be, of course, at the center of our discussions, a pan-Canadian approach to this challenge. But here in BC, we have a public health care system that is second to none. Dr. Henry, our provincial health officer, has experience fighting epidemics nationally and internationally. She was, of course, in Toronto in 2003 with the SARS outbreak, and in 2009 played a key role with the H1N1 outbreak. Dr. Henry and the experts of the Centre for Disease Control are extraordinary individuals, and they've been doing excellent work to give comfort and confidence to British Columbians that we're doing everything that we can to protect their health, their well-being, and, of course, ensuring that there's a seamless transition if there's a need when the outbreak, should it occur, gets worse than it is already. 21 cases, as Minister Dix and Dr. Henry have advised you, 4 in recovery, only 1 currently in an ICU here in British Columbia. I believe that we're on the right track, but we need to be vigilant, and I want to give British Columbians every confidence that the people here are at your disposal to give you information as it comes forward. And now I'll pass it to Minister Dix.
Thank you very much, Premier Horgan. We know, because we've been here before in British Columbia, that the key actions to deal with an epidemic are isolation, both individual isolation and, if needed, large-scale isolation, widely communicating critical information, things such as proper hand washing, appropriate mask wearing, calling ahead to doctors' offices if you are concerned about symptoms. We have done nearly daily briefings, as you know, with the media and have a team devoted entirely to ensuring all communications is up to date and accurate in real time as the situation evolves. Detailed public health investigations to take the path of exposure and ensure everyone is getting the care that they need, and ensuring we can mobilize rapid response teams quickly as the situation evolves. Today we are outlining in detail that in BC we are and have been ready and responsive. On January 25th, 6 weeks ago, BC established its Provincial Coordination Committee, co-chaired, as the Premier said, by Dr. Bonnie Henry and Deputy Minister Stephen Brown. Since that time, exactly 42 days ago, we have identified 21 cases in British Columbia, only 1 of which has been admitted to the ICU. As Premier Horgan mentioned, BC was one of the first provinces to rapidly develop its own test to detect COVID-19 so we could quickly identify anyone in BC with the virus. This meant that we could find people efficiently and also identify those who did not have the disease, making our response more effective. As the Premier mentioned, we have tested exactly 2,803 samples as of last night, involving 2,008 individuals. And for those of you who understand and have seen the numbers before this, this is almost a doubling of the numbers in the last week as we have consistently upgraded our response. Our response provincially and federally needs to carefully balance health risks with social risks and economic risks, and to be able to adapt quickly as situational changes arise. As we updated our plans, our primary focus has been minimizing serious illness and overall deaths and minimizing societal and economic disruption. At present, and Dr. Henry will speak more to this, our province's current focus and continued priority is on containing any instances of the virus through rapid identification, containment through isolation, monitoring and surveillance, and responsive health care. We are in close collaboration with the federal government on border surveillance, travel advice, and follow-up for travelers. And our focus will continue to be on enhanced screening, information and awareness, and testing for travelers at borders as required. Our priority at present is to do our best to prevent, but at least, and certainly to prevent the virus, to contain the virus, and at least delay the onset of widespread community transmission for as long as possible to get us through peak influenza season. Contain and slow, but be prepared. And that is what today's discussion is about. As the Premier mentioned, I'll go into further detail on this now. We have updated and are ready to use our BC Pandemic Provincial Coordination Plan as necessary as the situation evolves. This is a whole-of-government plan involving cross-ministry coordination increased internal and external communications while ensuring provincial government business continues as normal. This plan can be found online on the Provincial Health Officer's webpage for pandemic preparedness. The Premier's cross-government minister and deputy ministers' committees will be coordinating action and resources across government, adapting and increasing our responses quickly. While we are not at this point yet, BC is ready and willing to use emergency powers should they become necessary, as set out in the Emergency Program Act and the Public Health Act. At present, we are focusing on 4 key areas. They are as follows. 1, protecting the population. 2, protecting our most vulnerable citizens. 3, protecting health workers. And 4, supporting our healthcare system capacity. And I want to briefly lay out what measures we are taking in each of those areas. As the Premier mentioned, we are increasing our testing capacity with additional sites and equipment across BC. We are increasing our proactive and targeted communication of potential risks for general population and more at-risk people in our communities. There's a series of measures we're taking that you were briefed on previously in terms of public communication. But key to it, and all of you have heard this both from Dr. Henry and myself many times, is frequent hand washing. It's not touching your face. It's staying home when you're sick, staying home from school, staying home from work, and not visiting friends and family in hospital and long-term care if you have any symptoms. We are enacting government continuity plans to prepare for the possibility of high absence rates due to illness or if employees are absent to care for families, and making sure that key functions within each ministry can continue normally. This includes providing employees with the option to work remotely, coordination within and across ministries to ensure that essential government services and programs have staff coverage to continue with minimal impact. We are prepared to reach out and work with institutions and businesses to help them manage through a sustained 3 to 4 month outbreak. This includes working with and providing guidance for business, employers, and unions on implementing business community continuity plans, protecting staff, working from home, or holding virtual meetings. This means working with grocery store chains to monitor and ensure supplies for daily living, food chains and key suppliers to prepare and develop contingency plans, public transportation to reduce infection spread, tourism, and in particular, establishing protocols for cruise ships in advance of the season starting in British Columbia in the coming months. This means providing guidance and ongoing support to municipalities, schools, and post-secondary institutions. As the Premier said, this includes, as requested and as needed, using emergency powers to address a range of scenarios. The second, protecting vulnerable citizens. BC is developing specific advice and protocols for vulnerable populations to prepare. This involves taking sensible steps to avoid infection, advising them to support self-care and when and how to reach out for help, providing increased access to virtual care, and providing appropriate access to medications. Our focus here is protecting those members of the community who are at highest risk. And you've seen and heard through previous briefings who those people are, but we have, of course, a particular focus on care homes and on hospitals and seniors who are vulnerable and also people with chronic disease. And we are prepared, should it be necessary, to introduce an emergency fee schedule as needed to support this care. In order to protect seniors in long-term care, assisted living, and home and community care, we are prepared to activate outbreak protocols that are used every year during influenza season. These include, or not limited to, reducing the number of people coming into facilities, screening visitors who do come in, and adding vigilance to respond to any indication of illness. Thirdly, we need to protect healthcare workers, and that is a key element of our plan. And this involves reminding and maintaining best practices for healthcare, implementing standardized preparedness plans, and preparing provincially to coordinate and increasing local supply capacity and managing the supply chain for hospitals, communities, and primary care facilities. I spoke to Minister Hajdu, the Federal Minister of Health, just yesterday on this topic, and BC will be receiving a large shipment of additional supplies in the coming days. We are actively implementing plans to bring healthcare capacity to hospitals or community sites that come under stress. This may involve, again, should it be required, a program redevelopment of staff, a local redeployment of staff, I should say, program redeployment of staff, provincial redeployment of staff, working with professional colleges for privileging and or registration on an urgent basis if required. BC is currently in the process of establishing a list of healthcare workers who can be rapidly redeployed and is ensuring adequate management capacity for a sustained period. And finally, we need to support our existing healthcare capacity. BC, as you know, as the Premier has said, has established an Emergency Operations Committee, and we need to continue to build on that and build our work on that. We have functional protocols ready to implement to create capacity as needed in hospitals for discharging low-risk patients, deferring scheduled surgeries if required, and procedures, identifying capacity for new care spaces within hospitals, and ensuring we have the bed and equipment capacity to operationalize these plans. We have already implemented emergency department and hospital-wide protocols to safely triage and separate anyone presenting with respiratory illness. I wanted to just say finally, before I say quelques mots en français, that we have been working diligently on this question for some time. And all of these plans are being put in place because we know that we must prepare for the situation as it develops. The current plan, the current work has been, since we established the committee, been in place for 6 weeks. We have, as has been mentioned, 21 positive tests on approximately 2,800 samples. One person currently in an acute care hospital. So we are currently and clearly in the containment phase. But it is our responsibility and the Premier's direction that we have been preparing for a month for a more serious situation as it develops. We live in an interdependent world, as all of you know, and there are aspects of this that we simply do not and cannot control, and that's why we have to be prepared. Pour protéger les personnes en Colombie-Britannique contre le COVID-19 et atténuer l'impact de cette maladie dans nos communautés, le gouvernement de la Colombie-Britannique et l'Agence provinciale de la santé ont développé le plan de coordination provinciale pandémique de la Colombie-Britannique pour répondre à l'évolution de cette épidémie. Le Premier ministre John Horgan a aussi nommé un comité de ministres adjoints qui va superviser l'approche pan-gouvernementale pour implémenter le plan et qui va rapporter directement à un comité de cabinet que lui et moi co-présiderons. And with that, I wanted to introduce our Provincial Health Officer, Dr. Bonnie Henry.
Thank you. Thank you very much, and good afternoon, everybody. I want to start by saying that we do still have 21 people who have tested positive for COVID-19 here in British Columbia, 4 of whom, as you know, have recovered completely and have undergone the necessary testing. The one person that we do have in hospital at the moment is still in ICU, but her condition has improved, so we're very heartened to hear that today. Everybody else continues to be in isolation at home and to be monitored by public health across the province. So we are watching, as you know, we are watching what's happening both here in British Columbia, across Canada, our neighbours to the south, and what's happening with this virus globally. And we have been doing that from the very beginning. And I know there's quite a lot of people who may not have been at our many press briefings before this, so just to say a little bit about this virus. So this is a coronavirus. We know that coronaviruses circulate in animals, and for the most part, they don't make animals sick. And every now and then, they leap the species barrier into humans. And we have had that happen before with SARS in 2003, with one called MERS, which is the intermediate is camels, and it continues to cause disease periodically in parts of the Middle East in particular. And now, as of late last year, we've had this one which has jumped into human populations. The initial outbreak, as you're aware, has been in Wuhan City and in particular in Hubei province in China. But over the last number of weeks, we've seen it transition to many, many countries around the world. And today we know that over 80 countries have had cases of this. We're particularly have been watching what has happened in China, and there's very detailed and strong isolation measures and types of responses that we have never seen before put in place in China. And what is heartening to us, and when looking at the data, there's much more that we know about this virus now. There were many unknowns at the very beginning. We didn't know if the types of control measures in China would work. But we now have a lot of data that tells us it did. And we have a roadmap. We understand the things that we need to do here to protect ourselves and our community. We know that there are actions that we can take that will prevent the spread of this transmission. We've learned a lot about the genetic makeup of this virus. In 2003, it was months before we had a test for SARS. So within weeks of the genetic sequence being published from China, our lab here in British Columbia was able to develop a test that allowed us to determine who had this disease and who didn't. And that's a really important thing. It's been key to our ability to understand how this virus is spreading in this province. And so I've been talking quite a lot about contain, delay, prepare. And that is the mantra that we have been working on. We've been watching what happens in other countries that have not maybe been as prepared. We've seen what's happened in countries like South Korea, like Japan, what's happened on the cruise ship in Japan, and now most recently in Iran and in northern Italy. We know that the activities that we do in public health to identify people early, to identify all the cases, the contacts that they had, and to be able to isolate them and when they're in the incubation period. So that's the period between exposure and when you develop symptoms yourself. So the differences with this virus that we know, it's less severe in many ways than SARS, which had a case fatality rate about 10%. We're much less than that. But it's much more severe than what we see with influenza that circulates and affects people in our communities every year. So we're right in that spot where it is more transmissible, so it spreads from person to person much more easily than SARS, but not as easily as influenza, but causes more severe disease. It's a very challenging virus to be able to contain, and we've seen that globally. We've been doing our focus on identifying people who are sick, making sure we understand who their close contacts are, and putting them in isolation before they develop symptoms themselves. And that has been working. Our last four of the last cases that we announced just this week were people who were in isolation because we knew that they had been close contacts of a person who had traveled here from Iran. So being able to contain them means that they no longer transmit to somebody else. And to us, that's called breaking the chains of transmission. So when we look at how this disease is progressing globally, we start with, there's countries that don't have any cases. Then we have individual cases, and that's where we have been for the most part. We also know that then there's clusters of cases that arise in some communities. We've had a little bit of that here, where people haven't realized that they've been at risk of COVID-19 and have transmitted to several others before we have identified them. We've been able to contain those by using the public health activities that we do every day. We are looking for and preparing for other areas or other ways that this virus has been transmitted in communities around the world. So part of that is managing community outbreaks. And northern Italy is a good example of that, where there was quite a bit of spread in the community before it was recognized. And there are additional measures that you need to take to address a community outbreak. And then in some countries, in China in particular, and Iran right now, there's a countrywide outbreak. We are not at that point in Canada or in BC. We are still very much in the case and small cluster management and the containment focus. But we really do need to think about what would happen and what would it look like and how will we respond if we start seeing some of those other scenarios here in British Columbia. And that's what today is about. It's about making sure that everybody is aware of what they need to do, and that all of government is behind us in making sure we have those tools in our toolbox, should we need them, to respond to a different scenario, in a changing scenario, either in one of our communities or more in the province of British Columbia. And so it's very clear that we are in a global situation. We are very connected around the world, and this virus doesn't recognize any of our geopolitical boundaries. So we need to take the measures that we can to do our very best to protect the citizens of British Columbia, everybody who is here in BC, but also to ensure that our healthcare system is protected and is able to care for people both who have this disease, if it progresses and we get more people who are ill with it, but also to effectively care for everybody else who needs our health services. And that's what the plan here is about. So we do, So what we can control, as I've mentioned, there are many things we can't. What we can control is how we prepare here. And the basics of it that I want everybody to think about in our community right now. This is a global crisis that we are all dealing with. We all need to take those measures right now to do everything we can to reduce the transmission of respiratory illnesses. And it comes down to those basic things that we talk about every day. Cleaning your hands regularly, covering your mouth when you cough, not touching your face and your eyes, and really importantly right now, having a very low threshold. Even if you just have the sniffles, even if you're starting to feel unwell, stay away from others, stay home from school, stay home from work. This is the one thing that we can do right now that is really important to prevent the transmission of this infection. And we are still in influenza season, so we need to be very vigilant about not spreading any of our respiratory illnesses to others, making sure that we're not going into hospitals, we're not going into long-term care homes if we have any concerns about respiratory illnesses, so that we can best protect those people that we know are more vulnerable both to influenza but also to this disease. So I'll leave it at that for today. Thank you.
Thanks.